I'm Dr. Jill O'Brien, pelvic health physical therapist, women's health advocate, and someone who's spent years helping women navigate the things no one ever taught us to talk about. We need better conversations about topics that matter to women. This is the place for real, raw, honest conversations. And on the couch, nothing is off the table. So get comfortable, because the conversations women have been waiting for are finally happening. Welcome to the couch. Hello, and welcome to On the Couch with Dr. Jill, where honest, real, and raw conversations happen surrounding women's health and wellness. Today, I am joined by a dear friend, colleague, and someone who quite literally changed my life and is one of my favorite humans on the planet, Stacie Hoffmann. Stacie is a conventionally trained physician assistant who brings functional and lifestyle medicine to her primary care practice. Stacie, welcome to the couch.
Well, thanks for having me. It's really an honor and a privilege to be sitting here next to you talking about a topic that I'm so passionate about.
Tell us a little bit about yourself and how you came to the journey of functional and lifestyle medicine within your primary care practice.
Well, I've been working in the community for a lot of years, and so I have been 27 years in the conventional healthcare system, practicing both acute and primary care medicine. And in about 2008, I transitioned into more specialized primary care women's health. Then in 2016, I started to pursue or kind of investigate functional medicine. I just didn't feel like I had enough tools in my belt to really meet the demands or in order to serve the population I was seeing in the clinic. So I went down that path, and then in 2021, I finished formal certification in functional medicine. I went on to do some more specialized training in functional medicine, women's health, since I was so passionate about that area, and then also became a Menopause Society certified provider. And what I love most about it is it allows me to wear both hats in my clinical practice every day. So the allopathic model kind of defines more of the what disease a patient has. But functional medicine really gives me more about the why and helps me take a deep dive into their health and more about the root cause of maybe what is going on with that person.
I love that. And so why specifically women's health? Was there something that set you on the path to really want to start reframing perimenopause?
Well, I was led to this area of medicine by mentors and colleagues, recognizing that I had more to offer my patients. I also, had years of patient experience, and I trained pre WHI and started practicing pre WHI, and also seeing the aftermath of WHI in clinical practice and recognizing and working with a lot of women who were suffering. Also, just personally, I lost my mom 8 years ago after a short battle with lung cancer. But although she passed away from lung cancer, what actually took her life, in my opinion, was perimenopause and menopause. She spent a lot of years suffering, with physical and mental health issues that were often dismissed. And the system really wasn't there to support her just because of the nature of the time in medicine. And so I was a teenager at the time, going through my own puberty as she's going through reverse puberty, and just the impact of her physical and mental health conditions, developing, cardiometabolic comorbidities and autoimmune disease, which really was all secondary to the stage of her life and not being well supported. And it really impacted not just her personally, but our family, and also, her relationship with my father.
Thanks for sharing that, Stacie, that story about your mom. As you know, that hits really close to home for me. My mom has early onset Alzheimer's disease, and when I started going through perimenopausal changes, it was kind of too late for me to ask her some of those questions about her experience. And that really has been a driver for me, both personally and professionally, because I have women sitting across from me, just as you do, asking questions, wondering how they can be healthier, and sharing similar stories to the stories that you and I have about our moms. And Alzheimer's disease and dementia and some of these other autoimmune diseases, they impact women so much more than men. And so there has to be a hormonal component to that. And I feel that we have to figure that out. Women are demanding that we do that, and they're demanding that we do better. Stacie, this brings me to my next question. Who are these women sitting in front of us? Who are these women if we could invite them to have this conversation on the couch with us? Who are we talking to today? And who should be listening and joining us in this conversation on the couch?
Well, literally everyone at the latter stage of their reproductive years. And I'll define that as, about age 35, only because that's when women are deemed geriatric in their pregnancy. Perimenopause is not a disease or a disease state. It's a natural process that all women will go through if they're lucky enough to live to this stage of life and they still have their uterus and ovaries. It's not something to fix, but it's something to understand and to work with. We offer guidance at other stages of life in infancy, childhood, puberty, pregnancy, but then it stops. And I think it's unfortunate, and maybe it's just because after pregnancy, the focus for women is more towards, raising children, career, caring for aging parents. But we really need to spend time at this stage of life offering anticipatory guidance for women, and this really should become part of their routine visit at age 35.
Kind of like we have a colonoscopy at age 45. This should just be a standard of care at this point. I love that. I wish I would have met you in my 20s so that we could have gotten started on this a little bit earlier. I still talk to my nieces about this who are in their 20s. It is really great to hear that they do have more resources now than we did. And it's exciting to learn from them as much as they're learning from us. Stacie, you and I both know that these symptoms aren't random. So please tell our friends, what are the symptoms of perimenopause that we really need to be paying attention to that are not just the classic hot flash? And why is it so important that we figure this out sooner rather than later?
Yeah, unfortunately, a lot of the symptoms are more subtle and happen years before women will really identify that they're close to menopause or even in perimenopause. The average age of perimenopause is 41, but it can start as early as 35. And we're talking about more subtle symptoms, things like irritability, anxiety, musculoskeletal pain, loss of tolerance to alcohol, sleep problems. Sometimes sleep problems show up well before any other symptoms start to come into the picture. So these are signals from our body that we really need to start listening to and taking seriously. Unfortunately, this is a time when medical gaslighting and feeling dismissed is common, but there are options to support the needs of women. Suffering really is optional. This is a period of hormonal chaos where we are really vulnerable metabolically, our brain health, our digestive health, and even our immune health can suffer.
So, Stacie, I really want to interrupt you and repeat what you just said. Perimenopause will happen if we are lucky, and that suffering is optional. I think it's really easy to get discouraged, when we have women sitting in front of us, but also ourselves when we kind of feel like we're falling apart. And I think now is the time that we reframe perimenopause. We reframe this and say that if we listen to these symptoms, this is actually going to empower us to make change at this point. I'll share a little bit of a personal story that you are very familiar with, that when I started experiencing perimenopausal symptoms, I was able to recognize that that's what was happening, and I made drastic changes to my life because of that. And I think because of that, I will have a much better quality of life in the future. I feel better now, I'm stronger, and I have a much better outlook on life than I did 5 years ago. Thanks to you for helping me to reframe my perimenopause. Okay, back on track. So we talked about the who, the what, and now we're going to talk about the how. How in the heck do we navigate this in an educated and organized fashion, and not just rely on heavily marketed products that are kind of shoved down our throat through the social media algorithm? Stacie, how do we navigate this?
Well, I think this is actually the most difficult question of them all, in part because it really is not a one size fits all. And the way the conventional system is really designed is it's the conventional healthcare system is more about symptom management than really addressing the root cause of the issues. I think it's important for a woman to have a trusting relationship with a primary care provider. I think it's important for her to educate herself so that when she comes to the appointments, she can bring knowledge and power with her. If she doesn't feel that she is well supported by a primary care provider, even though this really can be managed in primary care, then she may need to seek out a specialty care provider to help support her on her journey.
So, because cloning isn't a solid option yet, and you only have so much time in your day, what would you say are some recommendations or resources that we can share with the community that would help them to educate themselves and maybe start learning a little bit so that when they do go to their primary care provider, they are armed with education and resources?
Well, I do think Mary Claire Haver has a lot of really great information out there, both for medical providers as well as women. She's a conventionally trained MD, OBGYN, and also Dr. Carrie Jones, who's a
Love her.
naturopathic physician, gives a lot of support to perimenopausal women.
And what about a podcast?
I really like Everyday Wellness with Cynthia Thurlow. She's a nurse practitioner who is actually conventionally trained and worked in cardiology for a lot of years. So she's very passionate about cardiometabolic health, as am I. And she's moved more into the perimenopause and menopause space. And we'll be actually coming out with a book in the spring about perimenopause.
That's great. Stacie, I wish we had a little bit more time, but what are your closing thoughts for our community, and what are you hoping that they take away from this conversation?
This is really the time to decide how you want to live the second half of your life. It's time to double down and become very clear about the non negotiables. You really can thrive during this stage of your life if you implement foundational support, such as nourishing your body, moving with purpose, supporting your stress resiliency. Lifestyle foundations are really the base for which we're able to build those support measures from. Hormone therapy, supplementation, and other interventions are actually going to work just that much better because we don't have the quick fix. You have to have the foundational support. And I'm an advocate for lab testing. At this stage of life, getting foundational labs to really maybe detect something that could be developing before it really becomes a problem. And of course, this can be challenging in an insurance-based model. But fortunately, there are places like VRO Care and also direct-to-consumer labs, which allow you to be able to take a deeper dive into your health.
That's great. And I also just want to add that when you do feel all of these symptoms coming up and you do feel, at times that you're falling apart, it doesn't have to be overwhelming. Just do something. Just do one more thing. Start somewhere. And those small steps and subtle shifts really can, add up and lead to big changes. Stacie, thank you so much for joining us today. And thank you for joining us on the couch.